Back in the 1990s when I started my practice, it started out as a single practice, internal medicine. I saw adult patients. I took care of basic internal medicine type problems, performed physicals. But then as medicine evolved over the years and medical care has become much more complex and it seemed to be more disassociated. We saw that we had to combine other specialties within the practice to become more integrated, to provide better care for the patients, to coordinate their care. With this multi-specialty approach that we have, our care is improved because we have the specialist right here in the office. The medical records are integrated. We have easy access to specialist reports. They have access to the primary care providers' reports, including my own and the nurse practitioners. We have access to reports from the hospitals, diagnostic centers, lab facilities. The model that we are building is based on a model such as Mayo Clinic, where we are integrating various specialties within one building.
Many patients come to us for their yearly physicals, and they're not educated on exactly what type of tests need to be done, if they need to be getting a colonoscopy, or if they need to have a cardiac workup done. And so I do educate the patient on certain laboratory tests that we advise for their age, if they're needing certain cardiac tests, if they need certain vaccines. We have diagnostic services such as the echocardiogram, ultrasounds to rule out acute DVTs, which are clots in your legs, which can be extremely life-threatening. We also do stat laboratory tests such as a BNP, which can let us know if a patient is in acute congestive heart failure at this time. And again, if these results are positive or elevated, it will let us know that this patient needs to probably be seen by a specialist immediately or might need to seek hospital care for better care.
When I see my patient, I'm able to actually talk to some of our specialists while the patient is still here and get their input as far as what types of lab tests they might need, what kind of imaging or other tests they would need before they saw the specialist. So I think it speeds the process along of a patient coming in for an acute problem and getting worked up by the specialist.
I just had a patient this morning who was a new patient, for instance, and of course I ordered labs, and she says, "Where can I go and get those labs?" I'm like, "You can get them here." Then I ordered an ultrasound. She said, "Oh great, where can I get that ultrasound?" "You can get it here." Then I ordered a DEXA scan. She goes, "Well, where do I have to go to get that?" I said, "You can get that here." And she was thrilled.
Not only are we using healthcare professionals, physicians and nurse practitioners, but we're using the ancillary services of a pharmacist on staff and a dietitian and certified diabetes educator on staff to assist with the diagnosis, care, and treatment of our patients.
I'm used as a resource for the providers. If they have questions about medications, I'm there to answer their questions. Another area is transitions of care. Sometimes when patients go into the hospital, their medications that are ordered in the hospital are not the same ones that they were taking at home. Another area that I'm involved in is the dispensary, where we can actually fill patients' medications here in the office. And that is a big thing. When a doctor or a nurse practitioner writes a new prescription, they can actually get it filled here and start on their therapy right away.
We provide hospital services as well. And oftentimes patients are surprised that a doctor still goes to the hospital to see their patients.
I personally go to Memorial Hospital, and Dr. LaCicero also goes to Memorial Hospital. She also services Tampa General, and one of our other nurse practitioners goes to Tampa General. If a patient is admitted to either one of those hospitals, we will accept them as a patient, and we will see them on a daily basis.
There's specialists called hospitalists that take care of patients in the hospital who are very good, but they don't know the patient the way that we do. And we know the background, we know the intricacies, we know many times the family relationships and dynamics that could have a huge role in their illness and getting well. So we continue to see patients in the hospital. It provides continuity of care, and it also provides better care.